So we're going to demonstrate pulleys. You'll receive some pulleys in your shoulder kit. You want to take the tab of the pulleys, put it over the top of your door, and then close the door on it. Initially, you want to start with facing the door until you can reach 90 degrees easily, and then we'll show you what you can use them for after that. So you're going to go ahead and grab onto the pulleys. You want to use your non-surgical arm to do the work. The other one is just holding on for the motion. So you want to make sure that you have your arm directly in front of you and your thumb is oriented up, and then go ahead and pull down with your left arm to bring your arm up over your head. Whenever you do this, you may see that your elbow is trying to come out laterally. You want to make sure that it will try to come in this direction. You want to make sure that it stays directly in front of you. Take it as much as you can tolerate it. Hold it there for a count of 10. And then use your left arm or non-surgical arm to slowly lower it back to the starting position. Let's try that again. So come in front of you, keep your elbow in, go up, hold for a count of 10, and then let it come down. You can complete this with your elbow bent, or you can also take your chair a little bit further away and do it with your elbow extended. We're going to demonstrate pulley flexion at greater than 90 degrees. So whenever you complete this, you want to make sure that you use the non-surgical arm to do the work and let it passively move the surgical arm. So we're going to go ahead and use your left arm to pull you up into flexion. You want to make sure that your elbow stays directly in front of you. Don't let it laterally deviate. Go ahead and return it. And then use the non-surgical arm to slowly return it to the starting position. You can complete the pulleys with either your elbow flexed or extended. So we're going to go into extension, thumb pointing up, use the left arm or the non-surgical arm to pull the surgical arm up slowly. Hold there for a count of 10, and then go ahead and lower back down to the starting position. We're going to go into supine wand flexion, which is an active assistive range of motion exercise. So whenever you begin this exercise, you want to make sure that you have your hand oriented like this with your thumb facing up, and then you're going to go ahead and push up towards the ceiling, and then you're going to take it back over your head. What you can tolerate, gravity is going to assist us a little bit going into flexion, and then you're going to come back up and return to the starting position. And try that one more time. Go ahead and push up. The closer that you take your hands together with this, the more stability you're going to have. So if you have any pain with it, just start with your hands closer together on the wand, and then that should decrease your pain. So a simple technique that you can try at home is you can get a small towel and just roll it up. And then you're going to take this towel and place it underneath the elbow. So what this is doing is it's placing the shoulder in a more neutral position. If you don't have the towel there, what happens is the humerus comes forward and puts more pressure on the structures in the front of your shoulder, which is more painful. So go ahead and place the towel and then just relax your forearm. So we're going to demonstrate one external rotation. Before you begin external rotation, it's very important to place the towel under your elbow so that it's putting your shoulder in a neutral position. Then you're going to take the wand, and you want to make sure that you place the T in the palm of your hand, and then you're going to go ahead and use your left hand in this case to do the work. So you're going to push out into this position, which is external rotation. A common mistake that you'll see is people will extend their elbow. That's not doing anything for your shoulder. So you want to turn at a little bit of an angle, keeping your opposite hand at your hip, and then go ahead and push this direction. Hold there for a count of 10 and then return to the starting position. So we're going to show shoulder internal rotation using a towel, kind of like you're drying off your back. So you want to use your non-surgical arm to pull up your surgical arm. So you're going to place the towel in the palm of your hand, pull up behind your back like you're drying off your back. You want to hold there for a minute and then slowly return to the starting position. Okay, so you want to use scapular retraction to put your shoulder in a better position. Generally, whenever you're wearing a sling, then your shoulder will come forward. So whenever you do a scapular retraction, you want to make sure that you're pulling your scapula down and together. So you're using more of the mid trap and low trap versus the upper trap, and then go ahead and relax. And you also want to make sure that whenever you complete it, you're not pulling the elbow back, because you don't want to do any active range of motion of the shoulder. So just relax your arms at your side and then go ahead and pull down and together back, and then relax.